It doesn't matter.
Trump actually gave more money to the Clinton Foundation than
I'm
he
sure
gave
he
to his
did.
own. But the
But that
difference
doesn't
was
matter.
Trump is using it for political purposes, for legal
And so
purposes.
didn't her. So didn't
Not
she.
true.
Absolutely.
She
At
didn't.
during Secretary of State, when she got donations
Yeah.
from certain countries benefited from that donation.
What makes you
Okay.
okay? What makes you think that?
I was live.
What makes you think
we're
that
live.
if a Clinton foundation got some money to do some work in Africa, and an African or perhaps a Middle Eastern nation, which
Gave her the money.
gave her the money,
And then benefited on the other end for something
actually,
else.
maybe if they hadn't given the money, then you would be criticizing them because why is American money going to help all these people?
I'm not criticizing either one.
Okay.
You're saying one side is doing something wrong, and
And
I'm saying as a whole,
but
both
the Trump-
sides do something to benefit their own charity.
The Trump
she did it as
Foundation-
Secretary of State.
The
So
Trump
as Secretary
Foundation
of
is-
State, she did it, benefited her position, pumped up her charity, and then shared that wealth out with her friends. So either way, it's just like we're talking about when you're saying Trump did it for whatever he did it for. She did it for that reason.
Okay. Did
Whether it's right or
Clinton
wrong,
ever
that's how she did
pay
it.
legal fees or legal fines from his foundation?
Say it
From
again.
her? Did
I have no idea. I don't
well,
care.
Trump did.
I don't care.
Okay. Did Trump give political
you
money?
can't do that.
Huh?
You can't do that.
Well,
you can't do that.
When he was caught doing it, he paid a small fine.
Okay.
So his attitude is, I'll do whatever I damn well please, and if somebody catches me on it and I can't sue them for some other
Pay a
reason,
fine.
then I'll pay a fine. End of story.
Okay.
So that's
So
still
I
legal.
get away with murder.
You didn't get who did he murder?
It's wrong to do that.
It is a
Okay,
phrase.
so he paid a fine.
No,
Right.
not
So
okay.
if
So he paid a
Clinton
fine.
had
So he
done
paid a
something
fine.
like
He
that,
should've
which
gone
she
to
did
jail.
not do.
So should she go to jail?
No,
But
absolutely
the
not.
point is, she
Wait a minute,
didn't
she
do
should go to
any of
jail.
these things.
She didn't
Trump
do it.
did.
As Secretary of State, she used her power to pump up the foundation. Is that illegal?
She didn't
Is it
do
illegal?
that.
Is it illegal? Is it illegal?
But the
To
question-
use her power as Secretary
That's
of
your
State to pump
opinion
up her
that
foundation.
that
It's
she
a
pumped up her
questionable
foundation to
thing.
do that.
Is it illegal?
If in fact it was done for her benefit, it would be illegal.
If it was a
So
pre-
if they find out that, and if they finally say that her emails on her personal server, which is illegal, right?
No, well, it was
Absolute-
not illegal at
no,
the
I'm sorry,
time.
not her.
It was not illegal at the time.
In her head and everybody else's head that likes her.
Going
it's not
down
illegal at the
Lexington
time.
Street-
If it was somebody else
Yeah.
who you were against, then you would want to put him in jail.
No, I wouldn't.
Absolutely.
I didn't even want to
Absolutely.
put Trump in jail. I just wanted Trump to pay more than a few $1,000 fine.
Whatever they asked him to pay, he paid. Whether it was 1, 2, 3, 4, 5, it doesn't matter.
By the way, he also used foundation money
to pay the fines.
to pay the fines, and B, to avoid legal difficulties in Florida by paying this
And
woman.
Texas.
Yeah.
But that's all still legal, though, right?
Well,
No,
no, it's
as
not.
no, it's not.
So then why isn't he in jail?
Because.
Because he's Trump.
Yeah.
No.
Ultimately,
Absolutely is.
Ultimately, that
So
is
he's
the
not,
thing.
so he's not in jail because he's Trump.
There
Yeah,
must be
yeah,
legal
ultimately.
maneuvers that prevent that from happening.
Right.
I mean, I would imagine.
I'm sure lawyers figured it out and
Yeah.
said, this is what we're going to do so you don't go to jail.
I mean, that's what he
And
said.
just like Clinton went,
Well,
what she's doing with the emails, it's the same thing.
Yeah.
But she's
again,
going through that.
She has been accused multiple times for about 2 years.
Mm-hmm.
Well, actually, how long did they know? Did they officially know that she was on her own server? Year and a half?
But who officially knew?
Uh,
The government?
the government. Well, the government knew from
Well,
the
they
very
all
beginning.
knew. They all knew from the very beginning,
Yeah.
including him all the way up, all the way down.
Right.
But they all
Oh,
denied
by the
it.
way, all the
and they all denied it until the emails showed up
all
and
the
said, "Oh, you guys
Republicans who
knew."
were communicating with her also knew about it, and they denied it as well. So
Yeah, that's an interesting point. Actually, I didn't think of that.
They all denied it
they-
until the
even
emails come out and
Republicans
said-
knew it.
Right.
Even Republicans knew it because she must have been communicating with
yeah,
them as well.
Right. And she was Secretary of State for 4
So
years.
how come they did not raise that point earlier?
Because
There was
it
no-
was
there
no
was no-
political
there was no
advantage
need to
to
do it at
doing
the
it.
But actually, that's what I forgot the name of the person who said this. We only set up the committees to get her to bring her down.
yeah.
He came out with this
He was
statement.
one of the leadership roles, but he wasn't. McConnell. It was
No, he was
another
some- he was
leadership.
somebody
Was
else.
it the guy from
Yeah.
California?
I don't remember who
yeah,
it was.
he came out with it.
The whole Benghazi thing,
Yeah.
which went on, which began only after she became a likely candidate for president. Didn't it go
What-
on
what-
during
what do
the
you mean?
time?
What do you mean?
The whole Benghazi investigations?
Well, it happened before that. and
well
they-
before that.
Well before that, and there was talk about it before that. It came to head afterwards, but there was still the whole Benghazi thing. She was under scrutiny when it first happened, and it dragged on for a little bit. It lost its steam, and it gained steam again when she came back to be
Right.
right. But I mean, she was under scrutiny before that. As Secretary of State, she went and
Well, she's been under scrutiny since the what, 92?
For a long time.
When did they run
that's when-
for governor of Arkansas? That's when she started being under scrutiny.
Well, that was long. Yeah, that's
Yeah.
true. Actually, they have been
Right.
under scrutiny for a long time. But maybe we should go back to the topic we were going to start with.
Okay.
Yeah, what are we talking about tonight?
I was going to interject here to come up with this thing. What do we really agree upon?
Common ground thing.
Common ground thing. Now that Trump is going to be the president, what are the items which communities could agree upon, and to take it from there?
Let me present it a little bit different. We did this a couple of months ago, maybe 4 or 5 months ago.
Yeah.
We said, okay, we're a fractured group as well as a society. In order to achieve anything, what we need to do is figure out things that we can agree are problems, and then find potential solutions that we could live with. Obviously, we're not going to get everything we want. That's what a democracy is all about. You try to get something so that the vast majority benefit and that the minority gets protected. So, okay, since we were looking for a topic.
Yes.
I got one.
Okay.
Fix the problems in Obamacare without absolutely collapsing the insurance industry, because the insurance industry is really dependent now on Obamacare, and if they try to just stop it, it's going to be absolute chaos.
I think I agree with you there, because there is
Identify the
need-
problems and fix them.
because Obamacare, howsoever you describe it, is a system which needs to be fixed. Some of the items that can limit the premium increases in premiums, that can allow better coverage, that can allow better or slow down the co-payments. All those things somehow have to be fixed. And rather than take an axe and chop it off, I think that would be wrong to do, because as you said, there are more than 20 million people who are
Well,
dependent
it's
upon
not
that.
just 20 million people who lose their health insurance,
Rest
but
of the people.
the insurance companies have set up themselves to work with it, and that will throw the insurance companies in absolute chaos.
And also preconditions. People are allowed to carry on the preconditions, so that you're not denied. And
you're not denied
yeah,
because you were sick before.
yeah,
and
you're
you
sick
can't-
before.
And, by the way,
But
you're
by the
not
way-
charged 10 times
Yes.
more than anybody else.
Yeah.
Which,
Yeah.
by the way, insurance companies have
Do
that
it,
right.
Yeah.
do it anyway. Yeah.
Right.
And at the same time,
Life insurance companies.
yes,
sorry,
and
life insurance
yeah, and at the same time, the difference between in premiums between men and women, and how do you
Smokers and
smokers
non-smokers.
and non-smokers, how do you really reconcile that without breaking the whole thing? And that's an important point. They could discuss
the
that.
easy way to do it is just to say, we're going to have one premium, and that's it for everyone.
I don't know whether you.
And that's what insurance is all about. Distribute the risk.
Yeah, but I don't know. I don't think. Well, you would know more about it. Whether if the insurance companies really have one single premium, they have different scales
They have
depending
different
upon
tiers,
depends
Right,
on
right.
what kind of where you
Single.
are,
So-
what your status is,
so-
what your age is, and
Right.
all
So the
that.
basic health care is would be for everybody,
Mm-hmm.
and then if you want to buy an extra policy, you can.
I mean,
Yeah,
that's
but that's actually Obamacare.
that's what right now is
that's
Obamacare.
That's what they have. You can come into Obamacare and be at the bare minimum.
Except you can't do that because some states don't have it.
Yeah,
Don't-
but
don't
that
have-
is what needs to
don't-
be fixed.
But all the states
All
kind
the
of
states have it.
All the states have
The
it.
difference is whether it's a statewide
right,
or a federal.
run, and all the
Right.
different. And one of the problems I think with this, and I'm glad you guys brought this up, because a quick guide to rising Obamacare rates.
Okay.
right? Which is, if I can find the article that says it, where is it? It's all about the states where
Yeah.
Yeah,
You
states
have
have the ability.
39 states where people sign up through the healthcare.gov website and supplementary data from other states. So that there's a big variation nationwide. Customers in Phoenix are looking at a premium increase of 145%, while customers in Providence, Rhode Island are looking at it at 14%.
But
Decrease.
The thing,
Decrease.
but the key point here is some of the states have opted out of
They opted
the
out
system.
of the
And
system.
naturally this
Like
they-
Massachusetts. Massachusetts has
no, but
mass.gov,
Massachusetts has its own system which is almost equal to what Obamacare is.
which is why it's, that was going to word, they used it to
But,
do-
but at the same time, the states have the ability to get federal funds, which
Right.
probably Phoenix doesn't.
Well, no,
No, they
no,
do it.
Phoenix
They do?
does. The reason why it goes up so much is you don't have enough healthy people getting into paying into it. Where, if I kept reading that, Phoenix has more minority assisted
Yeah, what-
insurance there. So,
What-
80% of the money going into the system is coming from the federal government in order to support it. Where you have to raise the rates to support that for the people that are not paying the system. So a place like Rhode Island, where it decreased, you have, like you were saying, you have enough of the people who are getting benefits and enough of the people who are paying into the benefits, so it's balancing it off.
So they have to work somehow, make
So
a system
we have to get
somehow
a system,
in,
what you
in
were talking
Arizona,
about.
so
Well,
that
and
becomes
you have to open the
equitable.
borders. You have
Yeah.
to open the borders.
Well,
where
they tried
go
that.
ac-
They tried
No, they
that. Yeah,
didn't.
you know, actually there is I forgot which states. They had tried across 3 or 4 states, and they said the rates did not change. But if they make it
I think if they did
nationwide,
it over-
if they
yeah,
make
they
it
make it
nationwide,
nationwide,
maybe
then
that
you-
will
then
that
we'll-
will help.
then- right.
Yeah,
But you have to also limit the subsidies going out, because there are a lot, when you read this and you talk about it, the people who don't have health insurance get fined $695.
Yes.
Well, guess what? If I'm single, I would love to give you the $695 because it's going to cost me $2,000 to get insurance. And I can still go to a hospital, or if I need it, go get something and pay for it cheaper than it's going to find me. So I don't need to sign up. And that's what they were hoping for this,
But-
where they'd have enough younger people who are healthy or pay into the system who weren't going to reciprocate anything back.
So how
And that's
would
not what- that's
so
not
how
what's
would
happening.
you penalize younger people so that they will really go and join? You can't find them at
You
few
can't
thousand
find
dollars.
them. No,
You ha-
you can't find them. You have to figure out a way.
you have to do it by a tax deduction. That's what.
So
well,
the problem with the tax deduction is that means the person has got to be working. And he's got to be working and earning enough money
Yes.
that the deduction
And that was
has
one of
some
the other
meaning.
things it was saying here too about the both
Right.
ends of the spectrum. The older generation who has Medicare and that it's subsidized and it was working okay. The younger generation who isn't working yet, up to 26, you can still be on your parents' health insurance. Well, even that's not helping because I'm not paying enough to support that system. If I have 3 kids who are like 22, 24, 26, I'm not paying enough to help the system. I'm getting more benefits than I'm paying out.
Right.
So it's not helping the system.
So
Well, the system is
the,
being
the other
helped,
Warren,
you know.
the other thing about states is that they have different rates throughout their own state.
Correct. Yep.
And it depends on what county you're in, or what city you're near, or what because I was listening to a guy complaining from North Carolina. He's in a what is he? He's in an affluent neighborhood. He's on the edge of an affluent neighborhood, but he's not working, and his health insurance costs him almost $20,000 through Obamacare.
Right.
Not through Obamacare, but through the
Through their
the
system.
state-funded thing.
Right.
Whereas
By the way,
people
did he mention that
10
he's
miles a-
probably getting some benefits from the federal government to subsidize
No,
his
well, he's
25?
probably
No.
working enough that he can't get
no,
Oh,
he's,
he said he wasn't working.
yeah. I mean, he wasn't he wasn't working enough to. If he had a job, he'd get it through his company.
Not necessarily. Not
But
it. Yeah.
some companies do. Most companies, most
and
small companies don't.
A smaller company under, I think it's 50 employees based on this law.
yeah.
Anything above, that's why a full-time, there's another thing based on this, when companies couldn't hire, because once you got to a certain level, you had to provide health insurance to full-time employees over so many hours. And that's why they were looking at this and saying the jobs weren't going up because companies were bringing in part-time employees. So they're raising it
weren't to
as
pay.
part-timers, but they don't have to pay benefits.
the-
So
the-
they were skirting it that way, and I remember it was either Markey or it was Warren, who was looking to go after companies like that because they wanted to be full-time, but you were killing the company because they couldn't afford to pay into the insurance because of what they had to pay. Because a company, I mean, you know this, right? Like, but I pay, what do I pay? I pay $1,500 a month, or no, sorry, $600 a month, and my company pays $1,700 for me. It's almost $2,300 a month for me.
Right.
Yeah.
If I had to pay all that, I couldn't afford it.
But that's why
Right, but that-
Obamacare
that's why-
should come in there.
But for a company, they don't.
No, but the
Right.
company does not have, they can organize a group, but they do not have to subsidize that insurance, which is one of the
But no-
things that they don't bother to tell you.
They have
If
to.
I've got a
they have
company
to
of
do
100
something.
people,
Yeah.
I can organize a group and negotiate with the insurance company
Yep.
to provide insurance for my employees. I don't have to give any money to that. I
You don't
can,
have to, but you'll lose your employees.
No,
No,
well,
actually,
You will
no,
lose.
the
You have to.
employee
You have
does
to have
not
some
have to
incentives.
sign up.
no,
No, they have to. They have
No,
to.
they don't.
No.
Yeah, because it's going to be cheaper for them to sign up through the company.
I agree, but
if
then
I'm at
they're
a
not going to
company,
leave me because
I would leave you.
why?
Because
I
I can go get another job, and because that company
if
over
I
there
could
will
get
subsidize.
if I could get another job, it wouldn't matter whether the company A had insurance or not. Let's say they would stayed at 49, so they wouldn't have to provide insurance. You're paying the whole ball of wax. I go to 51, I say, okay, I now got a group for you. Your premiums will be less than it's costing you on your own, and now you're going to go to another job. You would have gone already.
Yeah, I would have gone
Actually,
already.
no,
Since
actually,
you
Right, I
didn't
would've gone
go,
already.
you're getting a benefit.
but actually,
A, from working, and B, because now
But
I
they
just
don't-
reduced your
but
cost.
They don't get enough of the because when I had my company before this one,
Yeah.
we shrunk from 100 people down to 20. The guy who took over did that. He got us insurance and he didn't charge us the full amount. Right.
Okay,
So
good
that was
guy.
on him to do that, right?
Yeah.
To keep us going. For that reason, they keep us there. Because
Right.
if we had to start paying out, then we would have went because a technology job, you just go someplace else.
but there is actually, Bob has a point that there are actually now groups have come up who, this consortia, there's a, I heard it on TV actually, Liberty,
Let me see if it's in here.
it's a Christian-based
Yeah.
group,
Yeah.
Liberty Health Consortium or something.
Yep.
And where you pay small amount of money and they cover you a certain general
So
routine.
you join their organization.
You join
to
their
do it.
organization.
That's like Knights of Columbus,
And
right?
then- and
the
you're
reason
not-
why Knights of Columbus
and you
was
don't,
their
you don't get
insurance.
fined. You don't get fined.
Right, you don't get fined.
And they apparently there's a doctor who has written, a pediatrician. She has written a book about it, and I have not read the book. I only heard her start. She claims that it's a wonderful group. It's a wonderful coverage, and you go to them and you pay $500 something, and then you are all
So
set.
you could start your own cult.
Yes, I mean that's what I thought. Well, that would be a good thing if we start a cult that way. But
Yeah.
Obamacare allows that.
So, okay, well,
10 years ago when I was well, more than 10 years, let's say 15 years ago when I was consulting, there was a consulting group, a professional group that organized so they could have some group coverage. I'm not sure how much less it was, but it was less than if I had gone as an individual.
Yeah.
They gave me no money. They did not subsidize my thing at all. They just provided a letterhead. And that's exactly how any company could do it and
could.
be in compliance with Obamacare.
They could.
So they did not cost themselves one penny
Yeah.
by growing from 49 to 55.
Right. No, and no,
But-
I understand what you're saying, but a lot of companies
You just
won't.
said a moment ago
What?
that they won't grow because it would cost them so much money. It did not.
And they're
would
not
not
going to
have
grow
cost
as
them a
much as they
penny.
won't because a lot of the companies now, high tech, and even let's say like a grocery store,
Yeah.
right, who may not have supplied health insurance before. Now you go there and you're making $15 an hour, and now you have to buy into the insurance, and it's going to cost you $200 a month.
But you don't have to
$200
buy
a
it.
month.
You don't have to.
You don't have to if you have something else to do. If you have something else to do,
If you
somewhere
join a
else to go.
group
You
like
have the
that,
choice to
you
buy
join a
it or
group
not.
like that, then you don't have to pay a lot of that stuff. You just join the cult group, yeah. And so you're covered.
Not a lot of people know about that.
Yeah, but that's why I'm advertising it right here.
By the way, I'm a professional. I'm a registered reverend.
Yeah, well, we can start
So
with
if you would like, we can.
That's right.
No, but it's legitimate. Apparently, looks like.
I am legitimate. The state of Massachusetts recognized me about 50 years ago.
Oh,
But
okay.
what a lot of the high-tech companies are doing, because they have a lot of younger employees, is
Yeah.
they're paying 100% of the salary. They're paying 100%
Right.
to keep them there, and they're offering different benefits like vacations and
Right.
child away and things like that for everybody. You know, man, woman, whoever. And that's keeping that group together and
Right.
keeping them prosper. A lot of the older companies are eliminating all that stuff because they have too much overhead. They can't do a lot of the different things.
And
But
So
they're
that's where-
eliminating
that's
it
where
and
they're-
blaming
they're-
Obamacare,
But-
but
No,
in fact,
no, that was
Obamacare
even- that
doesn't
was even
care.
before
They're,
that.
they're
Obamacare was
eliminating
different
it,
for a
and now
different
they're
reason.
gaining it back. They're taking it back.
but
That,
at the
that
same time-
happened in my company.
Oh,
Oh, so they're taking the benefits back because now they can't hire some kid off the street to do your job the way
Yep.
they could
Correct.
2
Yeah,
years
it-
ago.
That's why
They
when you
went
offer
from
things like
3
that-
weeks vacation to 2
Right.
weeks vacation. Now it's up to 3 weeks vacation.
Oh.
It starts.
That's what I'm
Right.
talking about. When you have those benefits, you're going to attract.
Okay,
You're gonna
so
attract
therefore
talent.
Obamacare is at fault because it had no effect on any of this stuff. It was purely the
No, I'm
economy.
not saying that. Obamacare
Well-
is at fault because
Of what?
the flaws that are in it because of rising healthcare.
well, that
Well,
means
but-
because you went in head first and said, hey, everyone's going to get insurance.
Yeah.
And you thought because everyone's going to get insurance, everyone who's going to pay is going to subsidize everybody up the ladder.
Which was the plan.
Which was the plan that didn't work. So now when you look at insurance companies who are pulling out of it because they can't afford to cover that section, right? So when you look at it, like if you go to Mass Health or whatever.
Mass Health is,
Mass
is,
Health is
whatever-
the,
whatever
is the
the website
Medicaid
is.
piece.
okay.
There's tiers. You can go
MassGov,
Mask, whatever. You can go from paying, not even paying, but getting health insurance at a certain level for nothing if you don't make so much money, and then you can buy it at $1,000, $2,000. You can buy it all the way up to like
You can have the
$10,000.
Cadillac
You
policy.
got the Cadillac
Cadillac
policy.
policy.
If I
Yeah.
can afford $10,000,
Yeah.
why would I do that?
Yeah. Why would you do that?
and by the way, the
That's what I'm
government's
saying.
not paying,
Well,
giving
they-
you a penny
No,
if
they
you're
won't.
buying
They won't
that.
subsidize
Right.
anybody over 35,000 or whatever the number is. And there's not enough people on the other side signing up for that to push that through. That's why it's not working. Is it a good idea? Absolutely. It's a great idea to try and give everyone health insurance. But I think we started off on how do you make it work now? That's
way-
not
Yes,
working.
but Republicans have a really majority right now, and they have a choice to make.
They have a chance.
They have a chance to fix it.
make it work.
But they
I just
can-
haven't heard what they're going to do.
But
Yeah,
that's the problem.
they've had 8 years
They
to
wanna
think
say
about it,
repeal.
and
They
they
just
still
say
don't
repeal.
know.
Right.
They
Well,
say
No,
repeal.
actually, they've made progress. For the first 4 years, it was repeal Obamacare. The last 2 years or so, it's repeal and replace. So
But
they're
that's-
making progress.
I think it's always been replaced.
No, it was never replaced.
First it was
The
repeal.
intention was always replaced.
Well, I
No.
Intention
No.
was-
Even
because
now.
Even McCain, when he wanted to run 8 years ago, had an idea. So there was always that idea out there.
By
He
the-
always had an idea. Whether he could have pulled it off or not, we don't know. But
Well,
he had an idea.
Once they passed Obamacare 6 years ago, it was repeal Obamacare. Then about 2.5, 3 years ago at the longest, you started hearing repeal and replace. What they say at the rallies is almost always repeal and replace.
Well, I think, yeah, the
No,
underlying is
The
replaced.
Republicans
Well,
have a
what they're
chance now.
saying is
Republicans have a chance.
repeal and replace, and the most important thing is to repeal, and we'll think about how we're going to do replacing maybe in a few years.
Okay,
Well,
what I'm going to ask you guys to do, because this is common ground, and we've agreed that there are problems, and we've agreed that it's important. If we were the Congress, and if
Yeah,
we were the Congress and
Congress.
you're the president,
Yes, of course.
so because you're going to
Yes,
sign this,
yes.
what would we do that would make things better? Obviously, the first thing we do is take Obama's name off the new thing.
It doesn't matter.
Because if it was called the Affordable Care Act, the vast majority of the people in the United States like it. Yeah, they do.
It's still going to have the same problem.
I didn't say that. I said they like it.
They like a lot of the features
Right.
that are there in the Affordable Care Act. They just don't like Obamacare.
Yeah.
Right. It's kind of like I love Alexis. I really love Alexis. The only part about the
car
Lexus,
or the thing Alexis.
the car Alexis.
'cause
The only
Alexis is
part
also,
about
Amazon
the
for-
Lexus I don't like is the cost.
Yeah.
They're asking so much money, but I really like the car. The Affordable Care Act's kind of in the same thing. And if we agree that it's important that we do something, what are we going to do? Are we going to get rid of pre-existing conditions, allowing people who have diabetes or dialysis or all these expensive things to get insurance at more or less the same rates as everybody else?
Well, one of the major things you have in the coal country, for example, in the
Black
coal country, you have major issues, health issues, and they were able to get into Obamacare and afford it. Now, if you suddenly repeal it, they're up the creek. So you got to have something in hand, particularly
you have to figure out-
for these
you have to
devastating
figure out how you can
conditions,
cover
which
everybody.
provides us coal to burn so that we have energy. I mean, we got to have something for them right away, and you can't wait. So there you are. You can't just say repeal and that's
You have
it.
to look at it holistically from everybody.
No.
So
All right, so
Are they giving out too much? Meaning, is there too much subsidy? Is that why the rates are going up? I mean,
Obviously,
I don't know what the cause is. Right? Is it because you have too many people getting it for free, and there's not enough money going into the system to support it, and the federal government's trying to come over the top and they can't do it? So if that's the case, then maybe people have to stop paying. So you can't afford $200 a month, but you can afford $200 a month in something else. So guess what? Give up the something else and pay the $200 a month in health care.
all right. So I have a question for you. When you say the rates are going up, that's what the insurance companies are charging.
Correct. Because they're
What
losing
are-
money.
But what are the
Oh, that's their
people
business,
actually
actually.
pay? By the way, the insurance companies are not losing money.
They're
Truth-
not making enough money.
Um,
Because some of them
Okay.
have lost. Some of them have lost.
there's a major health insurer, one of the largest
That's
health
in
insurers.
California.
No, this is nationwide.
What,
This
Aetna?
is, no,
United Health.
United Health.
Thank you. United Health announced big block letters. We're getting killed. We're pulling out of Obamacare.
Right. And Aetna
Right.
is too.
Do you realize that a month later they announced their financials? They made a fortune last year. They're getting killed in Obamacare, except that they're making a fortune. Somebody's not telling us the truth.
And also in the percentage of business which they were dealing with in Obamacare was a
Tiny
little bit,
yes.
not the whole
Right.
thing. And
So-
the same thing for about Aetna,
yeah.
I don't know.
And I read Aetna 8 years ago was a beautiful case. They were taking 40% of the premium dollar for administrative costs and profits, blah, 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 blah. Obamacare said you can't do that. And so Aetna, the next year, had to send checks to their policyholders.
Yeah, that is one reason that the
refund.
companies don't like Obamacare.
Yeah.
Because they have to refund actually,
Right.
not repay,
They,
refund.
they were down to like 13% for administrative costs, which, by the way, is a hell of a lot less than Medicare. But we won't go there. We won't talk about that yet. Okay, so what are the good things that we want to keep in the insurance world? Do we want to keep the men and women pay the same amount, even though women use the health?
What do you mean? Why do they not pay the same amount?
Hmm?
Why do they not pay the same
Because women spend a hell of a lot more healthcare
Use
amount? I
dollars.
haven't
Use
seen anywhere on any website that I saw that said if you're a woman you pay more.
No,
It
you
used to-
don't. But they
used to be.
use more.
But it used to be like that.
Pregnancy is one of the most expensive things
In
that
every
you can do.
insurance you deal with, yes.
Yes.
Women pay more.
That's
Before this,
why-
I didn't pay any more. My wife didn't pay any more
If-
before this. I
if-
don't follow.
The law in Massachusetts, for as long as I can remember, was that everybody pays the same amount, even though women use the healthcare system more. Why is it that your wife's life insurance policy costs so much less for the same coverage than yours? Because she's more likely to live
longer.
Yes.
So she doesn't have to pay as much. But in healthcare, even though she's more likely to use health dollars, the law says she has to be charged the same amount.
Oh, I'm sorry. Yeah, okay. I misunderstood how you started this. I thought you said they're paying more for the same
No,
thing.
they're using more. They're
okay.
using more,
I
paying the
misunderstood
same amount. So do we want to keep
The
that?
law says that they
Right.
have to be the same.
But
Because
That's the same thing as somebody with a
but it-
pre-existing condition.
yeah, but
Right,
You
but
just
that,
put
the difference is
Well,
in
yeah.
other states that's not the law.
right.
They
You
do
were
pay
saying
more.
that your daughter in, I think it was Oregon,
Yeah,
was
she
paying either couldn't get
She
insurance or was paying
she
more.
was refused insurance because she had broken her wrist 2 years ago. Fully healed, but it was a pre-existing condition, so she was refused insurance.
Health insurance.
Yes,
I mean, that's sad.
Yeah.
Should
Well,
not
I
happen.
was
for
refused
a
something
broken
like that,
bone.
too.
Should not happen.
It was fully
In,
healed.
But that's there was life insurance.
Yeah.
Okay, well, life insurance is a totally different question. We can get into that next time. Health insurance, do we want to keep everybody pays the same for the equivalent coverage? Or do we want to go the way the insurance company, where the actuaries would like it to be, that you're in your 70s, you should pay more than David who's in his 50s, because you're more likely to.
Well, maybe when you think about pay more, maybe it's different times
No.
you pay more. Like if I'm going to the doctor's twice a week, every week for 3 years, I don't pay any co-payments along those times. Maybe that's something you add in. Make sure that they pay the there's a payment as you go. I mean, I pay $20 every time I go to the doctor.
The co-pays have gone up, actually.
Right.
Yeah, depending on.
Co-pay, yeah.
This is funny too. Depending on who you have as
Yes.
a health provider,
It
they've
goes,
gone up
yeah.
along with prescription drugs. Depending on who you have as a health provider,
Right.
they have tiers now for
Yes.
prescription drugs. And if you get a generic, you pay the very minimum. If you pay the premium, you pay the very highest.
Right.
Well, there is a catch now. What the drug companies have done is they have bought up the generic companies, and so they go back and charge the higher price again because they have bought.
But don't worry, Joe Biden's going to change all that. when he
No,
comes
it's not going to happen.
Yes,
that way.
there was an announcement today on the CNBC
Oh, is
to
it?
change all that.
No, that's
He's
not gonna
office.
ha- that's
in
not-
8 years to change it. And he's going to
No, it's
wait
not going to
till he
happen
leaves.
because
No,
pharmaceuticals are much
Trump
much
is going to
stronger.
change that. He's going to insist.
Who?
Trump.
Yeah, he
He's
will.
going to insist that if you don't charge minimum amount, whatever the hell that is, then he's going to send you to Mexico in return for the manufacturing jobs. The reality of the situation is we still have to decide in common ground. Do we agree that paying a single price for equivalent coverage should be part of the law? Having nothing to do with pre-existing conditions or maximums.
Right, but you're including everybody who doesn't pay now.
Insurance.
So you're saying everyone who doesn't pay their insurance now.
We're replacing Obamacare.
Right. So
And
but that's what
yeah.
I'm asking. So if you're trying to fix it, all the people who are getting insurance for free now across the board, they would raise up and pay what I pay.
Why?
Oh, that's
If
what
they
I'm
don't
asking.
have it, they can't pay it.
Right.
So therefore,
They will have the minimum.
So therefore, what you have to do is, for those who actually are employed, then you set the amount that you need and then charge accordingly to the people who are employed to cover
Who are or aren't.
who are.
Who are, yeah.
Everybody that is employed, there's a certain amount of dollars that cover 100% of the people in the country, and so the people who are employed will pay that amount. Another way to do it is
I don't follow you. So people who are employed pay this amount, but the people who
No.
get it for free don't pay
get it
anything.
because they don't have any money.
Right, but what we're talking about is trying to keep everybody the same.
Well, no,
How
no.
do we keep everybody the same?
The cost, you can have a
If it's-
subsidy as you have today with Obamacare.
But
The-
you can't.
the-
But you can have some subsidy, but you can't have what is going on now because they can't afford it.
Why can't you have what's going on now if more people are
Paying
part
into
of the
it.
system?
Right now, there are
the-
very few paying into the system because a lot of companies have insurance policies.
But they're paying into the system.
No.
They're paying into.
They're
the
not
public.
paying it. They're not
They're
paying.
paying the
they're
insurance
not
company,
paying.
but not,
Not-
they're not
not
paying
part of-
this kind of insurance.
But the companies are affected by this the same way that you're affected by this.
No, they aren't, because
Yes, they are.
uh,
Because their premiums will go up in the
They
states.
they can
eight
they can
years
choose-
ago,
afford that.
premiums were going up at 20 to 25% a year.
No, they weren't.
Yes, they were.
They-
No, they were not.
They were.
They were not.
I was actually on the board of a non-profit in Burlington, and the year before Obama was elected, we were faced with the rise in the insurance that we were covering our employees
That's
with.
what you were covering.
The
what you were
employees,
But the overall rate did not go up that much. what you were covering, what you needed was going up by 25% where you could get it.
Well, I'm not following
So
what you're
just
saying.
like this, so Arizona's 143%.
Right.
But
Rhode
what is the
Island's
what is,
going
when you say
down.
140%? What is the baseline? Is that $1? I mean, when you say 140%,
So from
Well,
last year's rates, it's going up.
so you have to see what the last year's
Is
rate
it all
was.
of Arizona or is it just Phoenix?
It says Arizona.
I
Well,
think
And then it says Rhode Island.
what I kept hearing, and unfortunately it was always from Trump, so it's not clear that he was giving us all the facts, was Arizona was going up. He
Right, and that's what
never
it says.
ever said anything about Rhode Island, but that's neither
Well,
here nor
they
there.
say a couple more states in
Right.
there, and they
Yeah,
they
it's-
cut a quarter
every
because
state is
everything's
different.
doing differently.
Right.
But,
Yeah,
but what you're
but-
saying, like my company, our rates didn't go up this year.
Okay.
The reason for that is what we were taking from the insurance company last year, we didn't take enough to warrant that to go up.
So who decides that? The
insurance company.
insurance company.
So
Okay.
what you're saying is that your nonprofit, however you needed to get your insurance, your liability raised it by 25% because that's what warranted for you to get the insurance.
What I'm telling you is when we went to that particular year was a year they were negotiating a new policy, a multi-year
Right.
insurance policy. And the insurance company came back to us and said, if you want what you have now, the cost is
Right.
25% more.
Right.
They went to some other
Mhm.
insurance agents and came back with similar numbers. So the rates were going up.
Based on you, but other companies at the time and other people at the time weren't seeing that impact.
Actually, they were.
They
Whether it
were.
was 25% or not, I cannot tell you.
There was
But
a 17
it was,
There was a-
it
there
was
al-
in
there's
fact
always a
going
little
up
bit-
at,
right, it was going up and
Before-
going
no,
up.
going up
Based
at
on-
a major rate.
Before
The-
Obamacare came in,
Yeah.
the rate of increase of premiums was about 17%
on average.
on average.
Right, on average.
But I don't know
Okay.
what it is right now.
Right. Oh, it's
Well, it's all over the
this
place now.
year it's gone up a
On
lot.
average, I have no
The
idea.
previous year, I think it went
Like-
up at a much lower
Yeah,
rate,
5
like
to 6%.
5 or 6%. If you look at it over the life of Obamacare, it is certainly less than 17%.
Because that's the whole idea was to flatten the trajectory somehow.
Try to flatten it.
Yeah, try to flatten it. Is it flat? I don't know whether that's what you're
Right.
saying. That looks like it is flatter.
Well, no, it's
Well,
going
no,
up and
it's
down.
all over the
This
place
year it
depending on where you are.
went way up.
so
Th-
I,
that's
Again,
because
depending on
there's
where
no
you are.
standard. If there were a standard,
yes.
as they have in, like for instance, Medicare, there's a standard.
Right.
Then if you have a standard, then everyone pays the same and everyone gets the same. Doesn't matter where you live.
To do that,
Should.
you would require basically a single payer system like
That's a good
Medicare,
idea.
which was the original proposal for Obamacare, and the Republicans and the insurance companies, by the way, this I know factually because my brother-in-law was president of a major insurer at the time. They said if you go with a single payer system, the insurance industry will be bankrupt in 5 years, I think he said, because they cannot compete on cost. The inefficient government was killing them on cost. So the compromise was that they would use the existing insurance system and they would set up minimums. One of the things that everybody's screaming about is the cost of my insurance went up, but instead of having it, and I have a $40,000 deductible, and they're asking for more. Well, the point is that with a $40,000 deductible, you were getting nothing. Unless you were on death's bed.
That's what people wanted, though.
Well,
Some
yeah,
people wanted that high
I
deductible,
understand.
so they would pay less out
Right.
of their pocket. And now they lost all that. So
And
some people even on that side.
what Obamacare was requiring was certain minimum care. You got to have a physical. You got to find out that there's nothing wrong with you, because maybe there is something wrong with you, and if they catch it early enough, they can do it cheaper.
Yeah, the cost will drop. Yes.
Yeah.
But at the same time, according to this doctor, the pediatrician, a lot of doctors do not want to take Medicare and Medicaid patients, because the reason she was giving is that there is too much bureaucracy. But I was wondering, whenever, it doesn't matter which system you join in, any insurance company, there is a lot of bureaucracy.
Yes.
Somehow the
there's
doctor is not really the person who decides. It is somebody in the back room
Yeah.
who decides your coverage.
The bureaucracy is that the Medicare doesn't pay as much as other insurance companies.
Yes, but that also means
That's
that
the bureaucracy
That's
they're
bureaucracy,
talking
what
about.
they're
Exactly the
worried about.
bureaucracy, because if you go to a doctor's office. Well, there's another bureaucracy which, if the doctors thought a little bit more, they would understand why they want Medicare. Every insurance company has their own requirements as to what the paperwork has to be. And that requires a tremendous amount of administrative work. If you were in a single payer system where all the stuff went to one place, there would be one set of paperwork.
Yeah, that would be easier.
Yeah, it would cost them less. They would get less maybe because they're getting all these people in, which is, by the way, the reason they accept insurance in the first place. Somebody who says, I don't want to deal with Obamacare because of all the paperwork, even though it bring me more patients, should say the same thing about Blue Cross. Because the same thing applies. Yeah. It's just different.
I mean, that's why.
And, oh, by the way, they may, in fact, give you whatever you negotiate with Blue Cross specifically, it determines what money you get.
What the doctor gets.
What the doctor gets.
Yeah, all insurance companies do that.
Well,
they
right.
all have their,
so,
you get charged $500 and the insurance company says, no, I'm only paying $250. They give them $250.
Right. But what?
And then I pick up the other $250.
Or not.
Oh, I
or not. Well, you do.
High deductible.
Okay. But the vast majority of people, the insurance companies says, okay, we'll pick up a little of this.
I mean, they did. They picked up half of it. But I got to pick up the other half.
Well, the difference between the 500 and the 250, either the doctor says, give me $250, which, by the way, even on Mass Health, even on where somebody's on Medicaid, the healthcare provider may send you a bill.
Right.
So, even though they've agreed that they will accept whatever the state gives, they may send you a bill anyway because maybe you'll pay it.
Right.
Isn't that
so?
back
That's
billing?
called fraud.
Yeah.
And it's very prevalent.
But what this pediatrician says is actually when you look at the billing systems with Medicare and Medicaid, and other insurance companies, the doctor gets 14 cents out of every dollar. The rest is not for him or her. The rest is, I don't know who takes all that.
Yes.
And I was surprised. I mean, 14 cents. What happens to the rest of it?
Why do insurance companies make so much money? Why?
This is talking about on the other end. When the insurance company, you're talking about the insurance company pays the bill.
The doctor gets only 14 cents. Everything else is gone for something else.
Well, part of it is the
everything on the floor. When you walk into a doctor's office,
right.
When you walk in a doctor's office now, everything's there. You got X-rays, you got blood, you got technicians,
well,
you got.
Right.
It's not just walking into the back room with one guy and giving him $50 to look at your tonsils.
Right. That 14 cents actually goes into the doctor's pocket.
But that, I mean, but the reason, when you listen to this, when you listen to that rhetoric, what happens is you wonder what happened to the doctor-patient relationship. But then but then you see the current system is set up in such a way that there are always going to be insurance companies who are the middlemen who decide what coverage you have, and accordingly they will decide what premiums you pay, and accordingly the deductibles will be set up. So naturally there will be this tier system. No matter how much we fix Obamacare, this different tier system is going to show up.
It will show up, and that's what's working out in Europe. Well, I'm say it's working. That's how it's working out in Europe.
Or in Canada.
Or in Canada, the same thing. You have that big room where everyone goes into because you all paid $5 for insurance, and you wait your turn. Or I paid $20 so I can go to a smaller room, or I paid $100 and I can just go see you. There's your tiers. If I had the money, and companies do that in Canada or in Europe, they subsidize
that's
their
Medicare.
employees.
You're not there yet.
Can I just get back to the 14 cents?
Okay.
For a dollar. I mean, think about it. You know, a doctor charges a bill of $100, he gets $14. But if he charges the same for the same work, if he charges $200, he'll get $28. So that's one of the reasons the medical bills are going up.
And that's why they have appointments every 6 minutes.
No,
I see.
Well, they have appointments every 6 minutes because there is a union called the AMA, which limits the number of doctors. Now, we're getting around that because now a doctor can employ a dozen physician's assistants who do all the work, and the doctor is now a supervisor.
But at the same time, the insurance companies demand that certain, or let's say a health maintenance organization demands that the physicians see that a given number of patients per day. Otherwise, they won't need the.
His organization has to.
Yes, his organization. That's the
I
health
have a
minister.
urologist who I have never, ever seen. I've never spoken to. I'm not even sure I've seen his signature. The PA
Yes.
who I see does an excellent job. I'm very happy.
Oh, that's good enough.
But do you get asked that question? You want to see a PA? Do you want to see a doctor?
No.
I get it asked all the time. Every
Okay.
time.
They do
I've
ask
never been
that.
asked.
I've been
And this
asked
is
every
Leahy.
single
They do ask that.
And I don't know if that's changed, but it started. We just got Tufts, so it started when I got Tufts.
Okay.
Before that, I was never asked.
I have.
And actually, Tufts, when I was going to physical therapy, first time this ever happened, Tufts made my doctor send a referral to the physical therapy place. The physical therapy place had to send an authorization to Tufts to get authorization for them to do physical therapy.
Okay.
Because
yeah.
they wanted me to go to a Tufts facility because it would have been cheaper.
I see.
Right.
Except I went to a different facility that I knew.
But I have Tufts.
That's the type of
yeah.
things too, because when you're talking about all these little walk-ins that are popping up, they're a lot cheaper than going to the emergency room. So an insurance company would actually want you to go to a pop-up because they pay less to them than they do to an emergency room. Same thing with MRIs and X-rays.
But they charge you the same amount, though.
They charge me
The premium.
No.
No.
The premium's the same.
Yeah, premium is the
But
same.
if I have a deductible and I go to that walk-in and say the X-ray's $100, if I go to Leahy, the X-ray's $400. I'm paying $400 because I have a deductible. I'd rather go over here and pay $100 because it's the same. It's an X-ray.
It's an X-ray.
Same thing with MRI. So that's what the insurance. We just had that meeting when we got the new insurance this year. The guy come out and said that if you have the opportunity, don't go to an emergency room. Don't go to a high-end facility. Look in your community for these little pop-ups because they'll guarantee you that they're going to charge you less. And sure enough, when we had my daughter got hurt, we went to the walk-in in Winchester, and it was a beautiful facility, and they had a pediatrician there. And again, we got a bill for $100. When we did that with my son, a couple of years before that, we got a bill for $700 when we went to the emergency room.
Wow.
Difference.
Okay. I went to a pop-up, actually, Walgreens in Las Vegas. I was coughing and sneezing. Yeah, Walgreens. I guarantee you, the insurance company didn't cover it.
Wow.
Because you didn't.
I don't know why they didn't cover the damn thing.
Wow.
And it's Tufts, by the way.
Because now they say they have to cover all that, and if you do that, you call your primary and tell them that you did it, and they refer it out.
Well, maybe it was. I didn't call the primary. I got off the airplane. My ears were blocked. I went to the thing, and they didn't cover it.
Well, that's strange, actually. They should. I
Well,
mean,
maybe I needed to call the primary, although Tufts is supposed to take care of emergency need.
yeah.
Right, they're supposed to.
And Tufts system is Tufts healthcare. No, what's it called?
I
Tufts
was
Health Plan.
told.
They're supposed to
Yeah.
be the best in the nation.
All my doctors
They
told me
claim that. That's what they claim, but I don't know.
I'm sorry, I had Blue Cross before this, and they were much better than Tufts.
By the way, I went from Blue Cross, but they canceled my particular plan that I had, so the doctors kept saying, go to Tufts, go to Tufts.
Okay.
Now I know why.
You know why? Yeah. But when I went to Tufts, it was Blue Cross charged, and this was something that happened. Actually, Tufts charged when I got my physical, my blood work. So I said that in the meeting. He goes, "No, that should have been covered in your physical." I asked the insurance company. They said, "No, it's not covered because of Rule 284 of Obamacare."
Oh, is it? Oh.
So I'm like, "Okay, that didn't make any sense."
Mm.
But that's where you have to question everything. So
Right.
he said, if it ever happens again, call the number on the thing for your provider, not the who we bought it through.
The physical was, according to Obamacare, I thought the physical was covered.
Physical's covered, but the
Yeah.
blood work for the physical is not covered.
That may be.
That's
I'm trying to
strange,
remember
actually.
whether they charged me for the blood work.
I have to look into
charged
myself too now.
separately
Separately
with a $15 fee.
yeah, something like that. Yeah.
I don't
They
remember.
saw,
Yeah.
all the tests were there, and they all had separate charges.
Oh.
This was $2. That was 20 cents. All of them. It was crazy. But that never happened before until I went to Tufts.
Wow.
No, they're all different, and they should all be the same. There shouldn't be any difference.
Well, then get rid of the insurance industry and go to do exactly what they did with Medicare. Back in the late '60s, I did a project at John Hancock. They got into Medicare late, and their job was they were going to be the administrators and deal with the paperwork et cetera, so that they could provide Medicare with the information necessary to pay the bill. And that's how it worked. All the private insurance companies took all the claims that came in, did the processing. And that was their job. And maybe that's what we should do. Maybe we should say single payer system, Medicare for all.
I was
Charge a flat amount. Those people who can't afford will be subsidized.
I was going to ask you a related question here. I'm not sure whether you would know the answer actually. That all the congressmen, which kind of system do they have? They don't have Obamacare.
They have their
Government.
Geico.
I mean,
Government employee insurance company.
but if they have that, that is a single payer system, right? No.
No.
No, it's their group plan, but they don't
So
pay
why
anything
what?
into it.
Okay, but why don't we
Well,
have
it's
the
not
same?
free. The government, the company that they work for pays for it.
Yeah, but why
Well,
don't we have the same? Why
so
don't we
it-
have the same system?
Because they're elected officials. They're above us.
If I was
I don't like that.
if
mean,
I
that's
was
what
a member of the board of John Hancock Insurance,
Yeah.
my company would pay for my medical insurance.
And,
It's no
your
different.
company sells a product to make the company prosper.
Mm-hmm.
Out of that profits, you pay your health insurance at whatever cost you do.
Okay.
The government collects taxes,
Which is a
which is not a profit. It's a
yeah,
tax.
it's a
it,
tax.
no,
Right?
the
And they
tax.
use that
It
money-
is an income.
It's-
use that
it's
money
an
to
income
pay
stream.
everything
It's
across
an income
everything.
stream, which is
But why do they not pay their insurance? Why do they not pay into their insurance?
Because it's a benefit.
because they get to vote on whether they should pay or not.
And they get to vote on their
So
salaries.
Congress
they get to vote on
is-
their raises.
yes.
They get to vote on everything
Right.
else for themselves.
Right.
But for me, I don't get to do any of that.
I mean,
anyway.
that's
Well,
that's
you know,
that should be
there's
changed.
another election coming up in 2 years.
No, but that
So
along with
here's
fixing
one
Obamacare,
thing.
they should fix that.
Here's one thing: if you get a subsidy and you're willing to switch plans, you have to pay big increases. More than 80% of Obamacare customers get subsidies that help them pay the cost of their
Yeah.
premiums.
Right.
Which is what they're saying. They're also saying 2017 premiums are actually a pretty good match for what the Congressional Budget Office forecast back before the Affordable Care Act passed in 2009. The big question now is whether this is a one-time jump in the rates or the start of ugly increases from now on.
Right.
So they knew back before it was going to start
Right. That there was going to be.
it was going
Right.
to. They just, I mean, this
But
is
politically,
this is obviously a big
right.
jump. Than
Politically,
what we're talking about.
they started screaming that, oh my God, amazing! There's a sudden increase. Nobody expected it. The whole thing's failing. Oh, by the way, I knew about it before, but I'm not going to tell you that. So we're back to how do we fix Obamacare? I assume we agree that pre-existing conditions should not disqualify you or cause you extra money. How about maximums in the amount that the insurance company is willing to pay? My dad, in 1967, was dying of cancer. He died March 8th. If he had lived to March 31st, the maximum of his insurance policy would have cut in, and they wouldn't have covered any additional cost.
Wow.
He was a good guy. He died early. I thank him very much. Do we want to go back to that system, or do we want the insurance companies to be required to cover whatever it costs, however long it costs?
I mean, isn't that where people were talking about death panels? I mean, you don't want that.
No, death panels are exactly what insurance companies do today, which
Yeah,
is
they
say,
do that
we
anyway.
will cover this,
Yes,
and
they-
we won't cover that.
That's but what you are saying is the extreme piece of that. That somebody is going to decide that once you have spent, let's say $50,000 or
Your upper
$1 million,
You're up.
then you are all done.
Well, that's called the actuary, and
Yes.
yeah, that's the way it was. And Obamacare said you can't do that anymore.
I mean, it should not be.
Do we want to go back to that, or do we want to say the insurance has got to cover you for as long as you're paying the premium?
As long as
As long
it's
as you're paying the
paying
premium and
paying
Okay.
going
premium.
into it, and you have somewhere along the line you're going to have subsidies.
Yeah.
Because you can't, when you retire, you obviously can't afford the same premiums you're paying now. So it's Medicare, and if that's working or not working, some of that has to kick in. Whether that rolls down more, and you cover it across everybody. Again, it comes back to the paying into it, and the cost of coverage, and the cost of getting an X-ray, the cost of getting an MRI, the cost of getting the drug. If all those continue to rise, then the premiums have to go up.
Yes.
If you can cap all that and start bringing things down, like a doctor's visit, why is it $500 or $500 to see a heart specialist, but $50 to see a guy for your cold? Because he went to college longer and he's smarter. Well, he didn't want to go to college as long, but he can cure my cold. So I'm paying $50 for you, but I'm paying $500 for you.
Don't go to him
Yes.
if you got a cold.
No.
I understood.
But-
But different conditions warrant different payments, right? If I'm just going to my regular doctor,
Yeah.
I'm paying $20 and I don't even get a bill because it's covered, right? If I fall down and I break my finger or I break something, I got to go see a specialist. Well, all of a sudden I need an MRI, that's $1,000.
Yeah.
I need X-rays, that's $500. The cost exponentially goes up because I use that.
I mean,
If I'm not using it, the cost is not going to go up, but I'm paying the same. I'm paying the same premium.
Actually, to address that, and it was put into Obamacare, was the idea that there's some people who go to the doctor for everything. And what they
Which
did
happened in
was,
Massachusetts
they-
early on,
right,
which is
so
why
they
the
put in
system got
copays.
killed right away.
they
And then
put in
started putting
copays.
Correct.
So that's one way to adjust it, and I'm assuming that we don't want to get rid of copays.
Well, you need everybody to have a copay.
Yeah.
Not everybody has copays. So
there are
Okay,
there are
that-
copays.
I assume they do, I don't know.
No, not everybody. Like if you get free insurance.
If you're on
There's-
Medicaid, that's a different
Medicaid,
story.
There's some Mass Health and
Well, Mass Health is Medicaid.
Mass Health is
That
Medicaid.
is Medicaid.
not all of it.
Yeah,
yes,
yeah.
it is.
Mass Health is Medicaid.
I thought it was still tiered, different.
No.
You get
Well,
Medicaid if you're at a certain level. You don't get
Yeah,
it.
but Medicaid, the Medicaid in Massachusetts is Mass Health.
We say real.
That's
Oh,
Mass
okay.
Health, actually.
We're almost
Come
done.
on.
Come here.
I'd like to introduce you to our executive producer.
What do you think so far?
Good.
You going
Good.
well?
Yeah.
You over here? Yeah, I think you're over there. You going well? Are we doing okay?
Yeah.
All right,
Oh,
good.
wow.
All right.
Thumbs up.
Hi, world.
Hi.
Hey,
Yeah.
Don't forget me.
Okay.
They're little fucking fart.
Ah,
Don't forget that, world.
wow.
Okay.
Cute.
Yeah, so that's so the different tiers of some people who go.
Right.
But so you're saying
Mass Health is Medicaid,
100%.
100%,
Mass
as
Health
far
is-
as I know.
Mass Health is
I thought that you were under a different tier with Mass Health, not Medicaid, because
No.
you still get but maybe I'm mistaken.
It's Medicaid. They
Yes.
call it Mass Health. I think Mass Health pre-existed, but it's
Yes.
Medicaid.
But
And
that's different from Medicare, though.
right,
so-
and Medicaid is a totally different system.
No, I know,
What's
but
covered, what's paid,
Yeah.
etc. If you go through Obamacare, by the way, one of the things that the Obamacare law provided was to enlarge the Medicaid population.
Right.
So, but that's not Obamacare with the exchanges, etc. That's a totally different situation. So if you're on Medicaid, you pay nothing because you got nothing. I've helped out people who were covered under Medicaid and they got nothing.
So then it must be something different, because I know people who are on Mass Health, whatever, if you call
Okay.
it Medicaid, that's fine, and they get the same things I get.
But
But
Obamacare,
no,
but
no, no, no.
Obamacare is not Mass Health.
No, in
Yeah.
Massachusetts, it's not Obamacare.
No, but
So
that's
they
Well,
they went through
no.
the health connector.
there's a
They
similar.
got
health
whatever
con-
it is,
yeah.
Not paying any premiums, not paying anything, and they go to the doctors and don't pay any co-payments. They have the
Okay.
same insurance that I have, in a sense, without paying anything. That's what I'm saying is that part of it, you need everybody to pay into. Everybody pays something.
All right.
And I think there was.
What do you do when you are capped at having no more than $2,000 in assets once a month? That's in order to be on Mass Health and to get that stuff. You have to prove that you got no more than $2,000
A month.
in
Every
any
month.
given
Oh,
month.
any given
In
month.
any given month, $2,000.
I see. Wow.
All your assets, etc. And that $2,000 has got to cover your food, your rent, your health insurance, your transportation, you name it. That's it. How are you going to have those people pay anything?
What position are you in to be at the $2,000? Can you get other money? Can you get other income?
No,
No.
And
no.
No,
All right, so
Your
why?
assets are $2,000
Why?
because that's what you got. That's what the state of Massachusetts says.
No, I'm not saying that. What's your situation to be there? Are you disabled?